Hello everyone, my name is Annette Hornby and I am the Quality Assurance and Professional Practice Director at CMRITO. I am also registered in radiography and sonography and have many years of experience in the field of medical imaging. The pronouns that I use are she, her. This webinar is one in a series of free webinars offered by CMRITO. Today's presentation will go over the decision-making steps you will need to take when you're determining if you should continue to perform a procedure on a patient. There are many things to consider under the Regulated Health Professions Act, or the RHPA, and the Medical Radiation and Imaging Technology Act, or the MRIT Act, and the regulations that are under these acts. You also need to consider what is it within your scope of practice. Do you have the knowledge, skill, and training to perform the procedure? And are you following the college's standards of practice, code of ethics, and bylaws? Lots of things to consider. So our agenda today, what we will do is we will go through a scenario where a sonographer is required to perform a specific procedure. And we will follow the steps the sonographer takes in determining whether they can continue or not continue. We will also use the decision-making guide for performing a procedure, and that's found in one of our What You Must Know About documents. And at the end, we'll give you some resources and takeaways. In this presentation, we will focus on the following two publications: the Standards of Practice and the What You Must Know About Performing Procedures for Medical Radiation and Imaging Technologists. The main focus will be the decision-making guide, which is on the last page of this publication. So here is our scenario. A patient arrives at ABC Diagnostic Imaging for a pelvic ultrasound ordered to rule out ovarian cysts. Shay, a member of CMRITO in the specialty of diagnostic medical sonography, performs the ultrasound. After completing the transabdominal pelvic ultrasound, Shay reviews the images and determines that they are suboptimal to rule out an ovarian cyst, as the entire ovary is not visualized due to overlying bowel. So for this reason, Shay decides that performing a transvaginal ultrasound would provide the necessary diagnostic information for this patient. Just remember, the original order was only for the pelvic ultrasound and did not include an order for the transvaginal ultrasound. So is Shay able to proceed? So Shay reviews the CMRITO decision-making guide for performing a procedure and uses it to understand their obligation before proceeding with the transvaginal examination. There are 4 steps to this decision-making guide, so we'll go through each step one by one. So let's begin with step 1. Shay asks, do I have the legal authority to perform the procedure? Issues that Shay needs to consider are: does the following procedure fall under the scope of practice of the profession as defined by the MRIT Act? Does the procedure contain a controlled act? And if so, is the controlled act an authorized act under the MRIT Act? Does the procedure contain a controlled act that is not authorized to Shay under the MRIT Act? And if so, is there a delegation in place giving Shay the authority to perform that procedure? A lot of things for Shay to consider. The first question Shay needs to answer is, does the procedure fall under the scope of practice of the profession as defined by the MRIT Act? If we review the scope of practice together, we see that the practice of medical radiation and imaging technology is the use of ionizing radiation, electromagnetism, sound waves, and other prescribed forms of energy for the purposes of diagnostic or therapeutic procedures, the evaluation of images and data relating to the procedures, and the assessment of an individual before, during, and after the procedure. Remember that the scope of practice applies to the profession of medical radiation and imaging technology, which includes all of the 5 specialties. That's radiography, radiation therapy, nuclear medicine, magnetic resonance, and diagnostic medical sonography. Next, Shay needs to decide if the procedure contains a controlled act. There are 14 controlled acts listed in the RHPA. Controlled acts are procedures or activities that may pose a risk to the public if they're not performed by a qualified practitioner. Controlled acts specified in the RHPA also state who can perform them. So if this procedure contains a controlled act, Shay must ask if the controlled act is one of the authorized acts under the CMRITO Act. Of the 14 controlled acts set out in the RHPA, there are 5 that are authorized to members of CMRITO. Shay knows that from the CMRITO Standards of Practice, 2 authorized acts give the authority to perform the transvaginal ultrasound. Authorized Act 3II in this case is putting an instrument beyond the labia majora, and Authorized Act 5, which is applying a prescribed form of energy. In this case, it's the sound waves. The final question in step 1 is asking, does the procedure contain a controlled act that is not authorized to Shay under the CMRITO Act? And if so, is there a delegation in place giving Shay the authority to perform that procedure? A delegation is the transfer of authority from a member of a regulated health profession authorized by their health professional act to perform a controlled act procedure, and they can delegate it to someone who is not authorized. This person that the authorized act is being transferred to can either be a regulated health professional or an unregulated person. Only regulated health professionals may delegate the procedure to another, subject to the standards and any applicable guidelines or regulations of that profession. Simply what that means is we, as MRITs, we can have authorized acts, controlled acts authorized to us, but we do not have the authority to delegate those acts to someone else. Physicians who are authorized to perform controlled acts can also delegate those acts. So that's the difference. So some of you may remember that in the past, sonographers did require a delegation from physicians to perform transvaginal exams. But now that diagnostic medical sonography is under CMRITO, and that is one of the authorized acts under the CMRITO Act, you no longer need those delegations. So using the decision-making guide has helped Shay determine that they have the legal authority to perform the procedure. And yes, Shay can now proceed to step 2. Here's step 2. Although Shay has the authority to perform the transvag exam, Shay now needs to ask, do I have the necessary knowledge, skill, and judgment to perform the examination safely, effectively, and ethically? Again, we will go through each of the issues that Shay needs to consider in the next few slides. So Shay needs to ask himself, do I have the necessary education and experience in this area of practice? Are all the provisions in place for me to perform the procedure safely under the RHPA, CMRITO Act, HARP Act, Public Hospitals Act, Independent Health Facilities Act, Nuclear Safety and Control Act, and any other applicable legislation? Are all the provisions in place for Shay to be responsible and accountable for performing the procedure and for managing the outcomes? Having considered the known risks to the patient in performing the procedure, the predictability of the outcomes in performing the procedure, whether the management of the possible outcomes are within their knowledge, skills, and judgment, and any other factors specific to that situation. The first issue to consider in step 2 is, does Shay have the necessary education and experience in this area of practice? Let me just remind you that every member of CMRITO has a condition on their certificate of registration that restricts their practice to only practice in the areas where they have education and experience. The CMRITO Standards of Practice require that every member ensures that they are competent to perform procedures they undertake and ensure that they have the knowledge, skills, and judgment to perform any procedures and manage any outcomes. So training in how to perform transvaginal examinations was included in Shay's educational program and during Shay's clinical training. Shay is skilled in the procedure and has even trained some new colleagues on the job. Shay knows they are competent to perform the procedure safely, effectively, and ethically. The next issue to consider is, are all the provisions in place for Shay to perform the procedure safely under the legislation? There's a lot to consider in this question, so Shay needs to reflect on which legislation applies to the practice of ultrasound at the clinic. ABC Clinic will have a license to operate under the IHF Act, which will outline the nature of the services offered at the clinic and other requirements to operate. The transvaginal examination is a common procedure performed at ABC Clinic, and all provisions are in place under these acts. So the final issue to consider in step 2 is, are all of the provisions in place for Shay to be responsible and accountable for performing the procedure and for managing the outcomes, having considered the known risks to the patients in performing the procedure, the predictability of the outcomes in performing the procedure, whether the management of possible outcomes are within Shay's knowledge, skill, and judgment, and any other factors specific to that situation. This is a long question, but essentially it focuses on Shay's ability to manage the outcomes and risks of performing the transvaginal procedure, and whether the management of the possible outcomes are within Shay's knowledge, skill, and judgment. Here, Shay considers topics such as contraindications and risks to the procedure. First, Shay consults the Standards of Practice from CMRITO to help ensure the practice meets the standards of the profession. Here, Shay will also reflect on their competence to manage the risks and the possible outcomes of the exam. Shay also looks to the department policies and protocols, which should also include information related to the clinical contraindications and risks associated with the transvaginal exam. If the department has a policy on chaperones for this procedure, and even policies and procedures around infection control and sterilization of the equipment. So using the decision-making guide has helped determine that Shay has the necessary knowledge, skill, and judgment to perform the procedure safely, effectively, and ethically. And yes, Shay can continue to step 3. Step 3 is next. Shay needs an order to perform the transvaginal exam. Shay asked the question, is an appropriate order in place giving me the authority to perform this procedure? We will go through the issues to consider for step 3 together in the next few slides. In step 3, there's only one issue to consider. Does Shay have an order either directly or through a medical directive to perform each component of the procedure, including the application of the diagnostic ultrasound or any authorized act or delegated control act? If you recall, the original order was only for the pelvic ultrasound looking for ovarian cysts. As we discussed in step 1, this authorizes Shay to perform authorized act number 5, which is applying a form of energy, and in this case, ultrasound waves. During the exam, Shay could not completely visualize one of the patient's ovaries, and if you recall, because of this incomplete visualization, Shay determined that proceeding to a transvag exam was indicated. However, the original order was not for a transvaginal ultrasound, and therefore Shay needs a new order to perform authorized act, which is 3II, which is putting an instrument beyond the labia majora. So Shay knows that an order is needed to proceed any further. This new order may be a direct order provided specifically for this patient, but it can also be a medical directive or a protocol, or sometimes you may recognize this as standing orders, which is probably more common in this type of situation. So Shay checks the protocols and the medical directives in the department that have been authorized by the physicians there. And if there is no order or protocol, Shay needs to stop. Shay needs to take the necessary action and get an order for this particular patient. So if Shay does find the appropriate medical directive, Shay also needs to determine whether the patient meets the criteria that are set out in that protocol. Shay needs to complete a visualization of the ovarian cyst, which does meet the clinical indications for a transvag exam under this department medical directive. In this case, yes, Shay may be able to continue to step 4. So we're now at the final step in the CMRITO decision-making guide that outlines the requirement for Shay to decide if all the conditions set out in the standards of practice have been met. Let's go through the issues together. Has the patient provided informed consent for the procedure? Is Shay able to provide the patient with clear and understandable information and instructions regarding the procedure and respond to their questions? Are all the provisions in place for Shay to be responsible and accountable for performing the procedure in accordance with the conditions set out in the Personal Health Information Protection Act and the Healthcare Consent Act? Are all the provisions in place for Shay to be responsible and accountable for performing the procedure in accordance with the conditions set out in the Standards of Practice, the Code of Ethics, and the Sexual Abuse Prevention Program? We will tackle the first 2 points in this decision step together as they are very closely related. Has the patient provided informed consent for this procedure? And is Shay able to provide the patient with clear and understandable information and instruction regarding the procedure and respond to the patient's questions? Let's discuss consent and how our standards of practice help explain what that means for a minute. As we discuss these 2 issues, keep Practice Standard 5, Relationship with Patients, in mind. Indicators A to E outline how members must provide appropriate responses to patient questions and accept the patient's right to consent or refuse the procedures. Members must always provide clear and understandable information to the patient or their substitute decision maker using an interpreter if necessary. Give the patient or their substitute decision maker an opportunity to ask questions. Also provide the patient or their substitute decision maker with answers to their questions within the scope of the profession's responsibility. Here it is important that the sonographer stays within the scope of practice of the profession. Indicator D further explains that the member must refer questions that are outside the scope of the profession's responsibility to an appropriate health professional for answers, and then carry out the diagnostic or therapeutic procedures only with the informed consent of the patient or their substitute decision maker. So here we're going to expand a little bit more on consent. Has the patient provided Shay informed consent for the transvaginal ultrasound procedure? So Shay is now the proposer of the transvaginal exam. Because this exam was not expected by the patient and perhaps not explained by the patient's doctor, Shay needs to obtain consent for this procedure. Consent includes being able to provide information on the nature of the procedure or the treatment, expected benefits of the procedure, risks of the procedure, any side effects that may occur from the procedure, any alternative courses of action, or are there alternative exams that can be done instead, and the likely consequences of not having the procedure. Obtaining informed consent also includes being able to answer questions about the information that you've provided. The consent may be in writing or it may be verbal, but it must be obtained before the procedure begins. Always remember to ask the patient's permission to begin the procedure. And finally, it's very important to note that consent may be withdrawn at any time. Even if a consent form was signed, the patient has the right to stop the exam if they feel uncomfortable or feel they can't go on any further. And don't assume that you have consent if the patient has had this type of procedure before. You need consent every time the patient comes in for a new procedure. The next two issues to consider in step 4 relate to the provisions for professional accountability. Shay understands the responsibility and accountability for performing the procedures in accordance with the conditions set out in the Personal Health Information Protection Act and the Healthcare Consent Act. That is to say, Shay is respecting the patient's confidentiality and has obtained proper consent to proceed. We discussed consent in the previous slides, and Shay's department policy will outline how to document the consent and keep patient information confidential. Practice Standard 5, which we previously talked about with respect to consent, also covers the Personal Health Information Protection Act and the Healthcare Consent Act in indicators M and N. Shay is responsible and accountable for performing the procedures in accordance with the conditions set out in the Standards of Practice, Code of Ethics, and Sexual Abuse Prevention programs of the college. The next few slides will outline where you can access these resources and learn more about them. So Shay understands that the Standards of Practice describe what each member is accountable and responsible for in the practice and reflect the knowledge, skill, and judgment that MRITs need in order to perform the services and procedures that fall within the scope of practice of the profession. This webinar has talked a lot about departmental policies and procedures. In the event that the Standards of Practice set a standard that is higher than the departmental policy or procedures, Shay also knows that all MRITs must comply with the standards set by the college's Standards of Practice first. You can find the Standards of Practice on the CMRITO website under Publications. The Standards of Practice are intended to be generic because they cover all 5 specialties. While practicing, Shay is familiar with and adheres to the Standards of Practice and their indicators. There are, however, a few indicators within the Standards of Practice that apply specifically to DMSs, and there are other ones that apply specifically to the other specialties. Shay needs to ensure that these standards are being met before proceeding. So when reviewing the standards, you will see language such as, in addition, members in the specialty of diagnostic medical sonography must. And examples include, in Standard 2, equipment and materials, indicator P, clean and or process transducers or ensure that transducers are cleaned or reprocessed after each patient's use in accordance with the manufacturer guidelines or applicable guidelines and facility policies. And standard or indicator Q, use, store, and dispose of ultrasound gel and gel containers in accordance with the applicable guidelines and facility policies. So these are very specific to DMSs and not specific to some of the other specialties. You can see there are specific indicators under Standard 3, diagnostic and therapeutic procedures that relate directly to sonography. And these indicators, again, have to be met before you start performing the procedure to ensure that you're performing it safely and competently. And again, in Standard 7, there is another indicator specific to sonography, and it's indicator O, which is record and communicate your observations and technical impressions regarding the diagnostic ultrasound procedure to the reporting health professional. So this often is known as a technical report or sonographer's technical impression, and this is what this is mainly referring to. So now Shay has ensured the patient fully understands the transvaginal ultrasound procedure and has consent from the patient to continue. Shay also understands that if the patient becomes uncomfortable and asks Shay to stop at any time, Shay will stop the procedure and make sure the patient is okay. Finally, Shay has ensured that they are compliant with the CMRITO Standards of Practice And yes, Shay can now proceed with the examination. I hope you have a better understanding of all the things you need to take into consideration before proceeding with a procedure, and I hope that this simple 4-step decision-making guide has helped provide you with a tool that you can take and use in your practice. CMRITO also has a number of other helpful resources for members. We have a series of publications called What You Must Know About, which provide topic-specific information and guidance for you in your practice. Some of the What You Must Know Abouts would be helpful in Shay's situation, and these would include what you must know about communicating with patients, the Healthcare Consent Act, and performing procedures for medical radiation and imaging technologists, which we have mentioned already as it contains the decision-making guide. All of the What You Must Know About documents are available on the CMRITO website under Resources and under Publications. So here are some questions that we get fairly frequently through email or by telephone. So I thought I would share them with you and hope that these common questions will help you in your practice as well. So the first question we have is, I believe we have a policy for performing transvaginal examinations. Is this enough? How can my facility policies help? So we have talked about the standards of practice in this webinar. And so as we've mentioned, the standards of practice are intended to be generic. Each indicator shows the application of that standard in practice. However, the methods for implementing the task or the indicator may be determined by the facility's policy and procedure. So each facility may be implementing it a little bit different based on their needs and criteria. So if the standard of practice, again, is set higher than the facility's policy and procedure, each member must comply with the CMRITO standards of practice first before they comply with the policy and procedure. And facility policies are helpful in establishing lots of processes. So some examples of those are obtaining consent and maybe for the presence of chaperones. This is a really good question, and we have had this. How do I know what to say? Tell me what I need to say to the patient. Should I have a script? Scripts are specific wordings that can be used when explaining a transvaginal procedure, for example, to your patient when you're getting consent. The benefits of using a script are it's having consistent explanations between all of the DMSs in the facility, and that the patient gets the same explanation if they come back for a follow-up. It's supporting your confidence because now you know you've got the right words and the right explanation to help your patient understand better. And it's ensuring important information is not missed. And it's helping to reduce confusion if the patient comes back for repeat examinations. So this concludes this webinar. I hope you found it useful and gave you some information that you can use back in your practice. If you would like more information on any of the topics covered in this presentation, please visit the CMRITO website, or you can contact the staff at CMRITO by email or by telephone. Thank you for your attention.